Joe 200, Dr. Walsh here, and yeah, it's actually I had to check my calendar. Today's the 25th. I should know that because some of you are in my 315 class, and the midterm was yesterday, the 24th. Um, that would be February 2020. So yeah, in honor of today, Tuesday, Fat Tuesday. Okay, it's all about Mardi Gras right now, baby. If you know anything about New Orleans, so. Let's see right now. Let's see if I can get this right here. I wear my Saints t-shirt, baby. Okay, it's all about Mardi Gras right now. And yeah, I saw something on the news this morning, and this place looks like the bomb. So if you want to go check out a really cool place, this looks like the bomb right here. Okay, this is uh this is down in Carson. It's called Daro's, and they have really looking authentic, really cool, authentic looking New Orleans cuisine. And yeah, I would check it out. Look at all these po' boys. Woo! Yeah, look at that catfish po' boy, jambalaya, red beans and rice. Looks really awesome. I wish I could go. I'll show where it is right here. Okay, here's a 405 freeway. Here's East Carson Street. Here's Wilmington, so it's right there. So check it out. I'm actually going to go there tomorrow. Awesome. Okay, where are we? Okay, so we are finishing up our biological component, and we're trying to make this kind of applied, something that you can take home. Okay, I want you guys to all become advocates for your parents and grandparents, but also maybe adjust your lifestyles so that you don't succumb to this situation, and because it's pretty tragic when we look at the metabolic syndrome, the continuum from diabetes to heart disease, and from heart disease then to stroke and Alzheimer's. So it's it's what happens when we're looking in a westernized, developed country. There's just too much riches in terms of food, and oftentimes um, we don't eat the best, and we don't exercise. We have a lot of stress, and all contributes to this. Okay, I do want you guys to remember things that are coming up here. So you guys got your CT done. We do have the midterm coming up, and you could read the directions on this. Basically, once you go in and take it, you have a 2-hour slot. Okay, the timer starts. All right, and you have 2 hours to finish it. Um, you can take it any time during this time period. Okay, all right, from Sunday, March 1st to March 6th. So we really opened it all up for you. There's no excuse why you shouldn't be able to get it done. Okay, and yeah, so that's what you need to do. All right. So we're going to come in here. All right, we're our weekly assignments. Okay, something you're very used to, and so we have gone through quite a bit. You guys are now very aware of global issues in aging. You're very aware about what's going on in our country. Our country is 331 million people, and what's happening in terms of the population trends. We gave you a little exposure to the biological aspects of aging. What we do know, things like free radical damage, are going to be relevant to what we're going to be talking about today. Okay. These are these oxidants that just cause disease. It's very clear. So you can take your antioxidants, man. Eat your kale, okay? Something like that. Anything green and leafy, anything colored and natural is going to help protect you, okay? And all right, we did cancer. We talked about diabetes, and then diabetes is the continuum to this, which is diabetic heart disease caused by what's called the metabolic syndrome. All right. So my video is going to go right here, okay? What we want you to do is familiarize yourself, okay? We, just in case there's a problem, we download all the PDF files, but this is the drill. You go right in here, okay? You go to this amazing website, okay? And it's coming. There it is, metabolic syndrome, okay? Put out by the National Heart, Lung, and Blood Institute. Again, these are agencies that exist because of your tax dollars, okay? So it's a pretty awesome thing. Okay, so what is metabolic syndrome? So you just click on it and it comes out. Okay, it's a group of risk factors: diabetes, okay, high blood cholesterol, specifically this type of cholesterol transport protein called LDL, or low density lipoprotein. When those are high, L stands for lousy or loser. Okay, or low levels of the good cholesterol, as they call it. It's actually a protein that goes and will suck the plaque right off your arteries and help protect you. And that's a H is for happy. That's HDL. Okay, makes me happy. Okay, so that's how you kind of remember that. So you want to make sure that your LDL is low, your HDL is higher. Okay, and the LDL cutoff is about 200. Okay, so and you'll see that with your parents' blood. So your parents are going to get blood tests. This is how doctors operate. Blood tests are everything. I'm going to show you right here when we look at diagnostics. Okay, um, you want your blood glucose to be lower. You want it to be resting blood glucose to be lower than 100 milligrams per liter. Okay. The other thing that we'll do is you look at how many proteins are candy coated, just like a honey baked ham. Okay. That's your hemoglobin A1C. It's a really good readout. Okay. Um, and so these are all diagnostic tools. Okay. So the diabetes, the development of these fat-laden plaques, okay, put you at risk for stroke, heart disease. This is all part of what's called the metabolic syndrome. Where is it in our country? It's scary. Okay, we have 330 million people. One third of Americans have this problem. Okay, that's mind-boggling. That's 100 million people, and it is a societal drain, financial drain. It's an independent drain on you. These diseases happen in your parents and grandparents. Sadly, this is ongoing in young children. It's why we have such an alarm going on with the obesity epidemic. All right, so we're going to talk about all these things. The plaque is the greasy, waxy occlusion. So your artery is this big, and then the plaque forms. It gets smaller and smaller. Then the blood cuts off. No more blood to the heart. You have a heart attack. A little section of the heart dies. No more blood to the brain. All right. You have a brain attack or a stroke. The brain dies. Okay. That's what this is all about. Okay. All right. So other names. This is hypertriglyceridemic waste. Okay. It's a big deal. When we look at metabolic syndrome, it's tummy fat. Specifically, they call it visceral fat. All your organs are just coated with this gooey fat stuff. And unfortunately, it releases the fat into the bloodstream, and your liver reacts and produces these carrier proteins, this loser, okay, low density lipoprotein. Okay, we need it, but in high levels, it becomes a real tragedy. It becomes irritating. It becomes the precipitating factor for your arteries to go like that and to have a heart attack or a stroke. Okay, so causes, so it goes into this. So like I said, the number one issue is obesity. All right, we have an obesity epidemic in westernized cultures. It is what it is. We eat too much, we exercise too little, and we're high stressed out. I mean, you guys are all freaking out about how am I going to get my job? How am I going to afford to live in Southern California? On and on and on. That releases this hormone, this stress hormone called cortisol, that elevates blood glucose and candy coats all of your arteries, makes it really hard. So that boom, what's going to happen? You have hypertension, and that irritates the crap out of your arteries. All right, and then it increases the LDL protein, the loser one that's bad, and then it goes to the irritation and starts depositing. Okay, all right. So again, you look at all the different problems associated with. It's just not just your arteries. You get kidney disease from this. I'm sure a lot of you have friends or family members that are on dialysis, but their kidneys are shot because of this obesity-related problem. They've had heart attacks, they've had strokes, they have deep vein thrombosis. If they're diabetics, they start going blind. You start having neuropathy and pain and losing limbs. It's a big deal, Okay, all righty. So, risk factors, okay? Did we just talk about obesity? We did, okay? The biggest kind of hormone messenger system in your body, that's called endocrine, is fat. Stomach fat is the biggest messenger, okay? And it's also the biggest inflammatory set of tissue. And inflammation is a bad thing if you haven't figured that out already, okay? So this inflammation that emanates from your tummy fat goes everywhere in your body and triggers problems. Okay, we look at who is affected. Okay, if you have a family history of diabetes, you're at super high risk. That means you and I, okay, could sit there and exercise the same and eat the same food, and I would be dancing around no diabetes, and you're gonna get it. Okay, because you're genetically at risk, genetically predisposed. Okay, alrighty. Women are good, boom, they go through menopause and suddenly it's a problem. Okay, alrighty. Smoking is a big deal. Okay, you can go check out this online calculator. Okay, so read through this. Okay, all right. So we're gonna be done with that now. Risk factors. Okay. Then we can look at screening. Okay, what are we gonna do? We're gonna do a blood test, and we're gonna look at what your total cholesterol, your LDL cholesterol, your HDL cholesterol, and your triglycerides. All right. And when you do that, there'll be a printout from your blood test, your levels, and what are the goals. And if your levels are too high, an asterisk is there, and the doctor's going to sit down and have a talk with you. Okay. Because you're going to take steps to lower the cholesterol, lower your triglycerides. What are you going to do? Green leafy veggies, less fatty meats. Okay. You're going to exercise, less croissants, okay, less pastries. It is what it is. All the great things in life. So you just got to learn how to enjoy other types of foods. Signs and complications, okay? So you're at risk for heart disease. We'll be able to test you by taking your blood pressure. You'll have ungodly high blood pressure. You should be at your age about 120 when the heart contracts and 80 when the heart is resting. So it's 120 over 80. The systolic is 120. 80 is when the diastolic is when the heart is at rest. When you get older, the goal is to keep the systolic under 140. Okay. But people will march up to the 150, 160, 170, 180, and all that pressure. It's like turning on a hose with a lot of pressure. It just damages all the arteries. Okay. Alrighty. So you don't want high blood pressure because it causes an injury. In comes the immune system. Then the plaques form, and it gets worse and worse, and you're going to have a stroke someday. You're going to have a heart attack. Okay. All right. How are we going to diagnose this? Blood tests. Okay. We're going to look at your BMI. Okay. We're going to check when we do the blood test your triglycerides. Okay. 150. Okay, is what you want per deciliter. Okay. Your HDL happy. Come on, baby. Let's get it over 50. All right. That's the goal. All right. Like I said, high blood pressure. This is for younger people. When you're older, we raise it a little bit. Fasting blood glucose. These are all numbers that you would be checking out. Okay. Alrighty. On and on and on and on. Okay. So these are just a short list. There's more that's out there. Okay. Okay. What are we going to do? Treatment. Okay. Come on, man. Just have a healthy lifestyle. It's the easiest thing and the hardest thing to do. Right. Try and live in the moment. Okay. Just go out and enjoy yourself. Try and reduce your stress. Exercise more. Eat better. That's it. Because if you don't, then I'm going to put you on blood pressure medication. There's no free lunch with any of these drugs, by the way. Okay. Blood pressure medication means you're going to be lightheaded. You're going to get tired. It is what it is, but it's going to keep your blood from pumping super hard. Okay. It's not great. Okay. We're going to have medication that will control your diabetes. Same drill. Okay. Medication that controls your levels of LDL. L is for what? Loser and lousy. All right. So it's not perfect, but it's been shown to keep you from having a heart attack and stroke. But you're gonna have to live with that. All right. I encourage you, if you have one of the 33 million people, what am I talking about? 33% or 100 million people that have this disease, to check out a clinical trial and see if you can get some state-of-the-art treatment. All right, so that's going through that system, and that's what this is all about right here. Okay, go back in there. It's a great resource to address some of the issues, okay, that come up in the quiz. Okay, all righty. This is a quick run through of how the plaques form. Okay, remember I said it was inflammatory. Okay, remember I talked about glucose and pressure and blood pressure and smoking and other irritants. They irritate the vasculature. you'll watch these two. This one is really good. It's cartoon based. You'll see how the plaques form, and you can watch the artery go like this, okay? And on this side, it's just ugly plaque, fat thing, and that just increases pressure onto itself. You throw a clot, the clot moves off, it goes up into the brain, boom, you get a stroke. Okay. All right. We end with sadly, we're trying to connect the dots here. So we talk about caregiving, okay? Because you know what the number one cause of disability in our country, okay, in modernized, westernized nations is stroke, okay? When this goes south up here, okay? And as a social worker, you know, you have to deal with older clients that have all these health issues. You know, a real growing career track because everything you've learned about in this class, because there's so many older people that are now in westernized countries, and it's a huge opportunity. It's sad, but it's a huge opportunity. Patient advocacy, that's what you're all about, okay? So we want you to deal with what it's like, okay? Family member or friend, okay? At the Gerontology Center, we have the Los Angeles Family Caregiver Resource Center. And that's because when you're doing the caregiving, you're having to care for a parent that's had a heart attack, a stroke, that has diabetes, and you're having to run them to doctors visits, having to, you know, do the day in really difficult care, it wears on you. It's so stressful that next thing you know, you start going down the same pathway and start having health problems that are related to this metabolic syndrome. So our Caregiver Resource Center has services of 1,000 clients locally. It's an amazing thing. We have caseworkers, and we provide help and respite for these poor people. You know, and I've been there. Everybody, you know, with my parents, it was really hard on me having to deal with my family and also be a caregiver. Okay, so address this in your discussion. All righty. All right, so that's it for this week. I'm going to stick this right here. Do keep up with the deadlines that are here. We list them here. We list them in the syllabus, and we're going to see you guys next time.